This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the Ph.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch. We're here, as per usual, every Sunday, 8 till 9 on Talk Radio 1210 WPHT. Health Watch features Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. I'm your host, John DeMasi. We are ready to get you healthy.
We're here to rock and roll.
That's right. And the town is painted green today.
That's right. Hey,
Okay.
that's
Championship Day here on the program. Dr. Molly is here, and again, we have a number in the studio, 855-839-1210. 855-839-1210 is our number. If you have a question or you have a medical challenge that you want to run by Dr. Molly, then you just simply call the show, and she will be happy to help you. Innovative Medical Associates helps people in a variety of ways.
You're right about that, John. And, you know, I think it goes back this week in particular, I would say. I was really, really impressed with the fact that people are calling the office and they get the difference between what we are versus the spas that have been opening up. And I think a lot of that has to do with you, thank you, because of what we are talking about on the radio. We are truly a primary care facility. All of the healthcare providers work out of our particular facility. And indeed, we see people who have anything that they would go to their primary care doc for, we can do. I like people to come to me when they've already gotten a diagnosis, and most people do. But it is an interesting phenomenon because we like to help people with natural substances. So we don't say throw away your medication, but we look at you as someone who's taking some medication for a problem. Can we help you reduce your need for that medication, maybe cut it in half, cut it in quarters, thereby relieving some of the side effects, not only from your problem, but also from the medication?
And if they call you and say, I want a massage, they came to the wrong place. They came to the wrong place.
Well, yeah, we can do that. We have wonderful practitioners of every sort, but fundamentally, if we're going to do a massage, it's on our patients.
Yes.
And there's a therapeutic reason, whether it's a lymphatic reason, something. But everything in our facility has a therapeutic reason.
So it really matters as to what you're
Yes,
offering them.
right, exactly right, John.
So,
exactly right.
Okay, so tell me really what you do.
Sure.
Because
It's hard to explain.
People don't understand
Right.
it.
But hydration is the vehicle by which we are able to deliver nutraceuticals and in some cases pharmaceuticals necessary to effectuate a change for a particular patient. So let's say someone comes to us and they have hypertension. You might get a program for you that might include a few amino acids that are naturally sourced that might be able to help reduce your blood pressure and help you then get off of some of your blood pressure meds. Don't throw them away. Don't cut them down on your own. You want to do this with the help of the healthcare providers in the office. But this is one example. We also have people who come to us with autoimmune issues. And so they're lacking sometimes some of their nutraceuticals in terms of what the body needs or cofactors. And that's delivered by hydration. So hydration is the mainstay of what we do, John.
And in a lot of cases, you're able to cut down the prescription meds.
Right.
Because of side effects.
Right.
So talk about the natural substances. Are there side effects there?
Of course there can be. That's why you and I talk about this a lot, because you were one of my first patients who brought something to my attention and made me almost fall over because it interacted with everything else you were taking. So yes, you want to look at the natural substances as if they were medication, because it's the medicinal properties of the natural substances that I hone in on. That's exactly what I look for. In other words, when you say, well, I'm going in for your drunk tank thing, you're looking at what? Vitamin C. But vitamin C has a medicinal purpose, you see. And I look at that, the constituent. What is the constituent? I look at amino acids the same way. What's the constituent? Homeopathics, the same way. The constituents are what I'm looking at, and how do they effectuate the change that's needed for a patient as he moves through the continuum.
Would you say that there's less side effects to natural substances?
Yes, when used appropriately, and also when used through the hydration, because it allows us to use an appropriate amount for an individual patient. As I say all the time, more isn't better. I had a potential patient this week who's telling me they're taking 5,000 units of a particular vitamin, and not vitamin C, by the way. And when I told her that this might be bad on her liver, she couldn't believe it. She said, well, it's natural. I said, natural doesn't mean good. And that dose doesn't mean it's an appropriate dose for you. Remember, the body still has to synthesize these or utilize them in a way that is functionally proper.
We should tell the audience that when you set up the protocols, I mean, those are your protocols.
Right.
Those are your recipes.
Sure.
That you've honed in for years.
20 years or so. Yeah.
Years of that. So talk about that.
Well, there are many times I use constituents in particular recipes. Sure, there are traditional recipes out there that have been used for the last 100 years by some physicians back in the 50s, that kind of thing. And for them, in fact, they're named after them. But, that's a great base bag. I'm not saying anything against that. It's wonderful. But what you really need to look at is the specialized nutraceuticals, whether they be amino acids, homeopathic, herbal. What is their relationship to certain other vitamins, minerals, etc., and cofactors? And how do you use those to really effectuate the change for the patient? So yes, and every patient, although the bag may look similar because there is some overlap, obviously, but in the end, it's very different from patient to patient.
And a lot of times patients will say to me, you have a yellow bag, I have an orange bag. Mm-hmm. I wonder why that is.
Well, yeah, because there's different...
Talk to Dr. Molly.
Right. And in addition, by the way, an interesting discussion happened this week in my clinic. You realize there are some nutraceuticals that are light sensitive. There are some nutraceuticals that have a half-life of 45 minutes. There are some that have a half-life of 2 hours, and there are some that have a 4-hour half-life. So imagine putting all of this together for a patient. Very important that you do this correctly.
And what can people expect when they have the initial consultation? What can they expect you to tell them as far as...
Wow.
And I witnessed a consultation, and we'll talk about that later.
Yeah.
And that was very, very sad. But what can they expect?
What they can expect is I want to get a history of what's bringing them to us. I want to then be able to sort of think about it and discuss it with my medical team as well as my nursing team and say, how can we approach this? And then I want to put together a plan, a game plan for that particular patient. And of course, we have to look at certain parameters in order to do that. And obviously, it isn't the kind of thing you just throw against the wall, but really the initial consultation gives me the data I need in order to really put together the program for that patient.
Should a patient bring their blood work?
I love all that. And more than that, patients are bringing bagfuls of nutraceuticals that, and here's the other thing, let's talk about the nutraceuticals we buy off the shelf today. Let me tell you, folks, all of the many of the great companies that were out there for the last 26 years have all been bought up by other companies because they see the dollar signs in this. So many of the smaller companies that were good or great have sort of come down a little bit because they're going to be mass produced. So let me tell you something, guys. You want to know the brands you're taking.
We are coming up on our first break of the morning. The show is called Health Watch, and you'll find us here every Sunday from 8 till 9. here on Talk Radio 1210 WPHT. Health Watch features Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. We have plenty of time to take your calls right now at 855-839-1210, 855-839-1210. You're having a medical challenge, a problem, well, Dr. Molly's here and she'll be able to at least try to help you. 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I return after these words. Welcome back to Health Watch. As always, operators are standing by at Innovative Medical Associates. And if you want to dial them, feel free to do that. And really, what you want to do is call and make the initial consultation, make the appointment. Dr. Molly is available, 856-489-0505, 856-489-0505. That's the number for Innovative Medical Associates. And as I said, you can call now and make the appointment for the initial consultation. It is complimentary, so it doesn't cost you anything, and you can find out a lot in that initial consultation. 856-489-0505. And you can check out the website because you'll get a lot of information on that. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. The other day, one of your nurses, somebody was saying, what's the website? And she said, gee, I don't know. And I happened to be sitting there. I said, InnovativeMedicalAssociates.com. I only say it
a million times.
I know. So it was really appropriate. So
thank you, John.
Got the website. 855-839-1210 is the number, 855-839-1210. If you have a question right now for Dr. Molly, you want to talk about P.O.T.S, POTS.
POTS.
And it is not the POTS that we think about.
It's certainly not the ones they use on the Food Network. So, yes, I do. POTS is an acronym for Postural Orthostatic Tachycardia Syndrome. So it's called affectionately POTS, which we're going to use in this radio segment. What it does is it's really a dysfunction of our automatic nervous system, ANS, that causes debilitating and unpredictable lightheadedness, rapid heartbeat upon standing, and many other symptoms. But that's one of the first ones that you see. And we see that lightheadedness happen a lot in older age, right, which we would expect. But just this week, I got a younger woman who came in to see me. And, what she said was she believes that she has POTS, although several physicians that she consulted thought that this is really a function of anxiety. So it's misdiagnosed a lot. But I'm going to take her at her word, because she has really kept a diary about all of her symptoms. And everything that we don't think of consciously is affected by this POTS syndrome. Heart rate, blood pressure, digestion, pupil dilation between, light and dark, that kind of thing. Some constipation, kidney function, and temperature control. Can you imagine? All of these particular areas in the body are affected by this dysregulation, including breathing. We don't even think about it, do we?
No, we don't think about that.
Well, what was interesting, in her history, I found out that she had COVID-19. And these symptoms developed post the COVID-19 a year and a half after her bout with COVID-19. She did take the COVID-19 vaccine. She took the booster. She took the third shot. And she had these particular symptoms: the lightheadedness, the fainting, the abnormal heart rate, palpitations, fatigue, and exercise intolerance. Then she continued to have difficulty concentration, headaches, certain tremors, and sleeping disorder, where she wasn't falling asleep like she usually did. She had sleeplessness. She had nausea and constipation. So she was smart enough to seek out possibly certain physicians who might help her with this, but ultimately they told her it was anxiety and in her head. Actually, I don't believe that. I believe that I have to take a functional approach to this no matter what it is. But it seems more likely that it is POTS, the POTS syndrome, which can be associated with connective tissue disorders like things like Sjögren's and other autoimmune disorders, which goes right into my wheelhouse.
You know, you've mentioned several things, and no wonder it's hard to diagnose this.
Absolutely.
Because it could be a variety of things.
Absolutely.
You mentioned like 10 things in one sentence.
Exactly. And don't think that they don't immediately, if you know, here's the thing. The thing is, you want to use functional medical tests for this. So you might want to test for adrenal function, something they don't always do. And with stressors in your life, with like the infections, when I'm talking about stressors, I'm not just talking about mental health stressors. I'm talking about physiological stressors, imbalance in our blood sugar. Infections cause that, viruses and the proteins they leave behind, you know, COVID and post-COVID syndrome, long hauler. So I'm looking at this kind of thing. So cortisol should be tested. We should look at thyroid function. We have to look at running nutritional testing because we really want to look at vitamins, in particular the B vitamins. We want to look at things like insulin level. We want to look at things like possibly fructosamine, which is a sugar that is found in the body. So there are so many things, and we need to look at what kinds of issues and how the relationship of these tests are to her symptoms.
Is COVID really the reason behind this, or is that just one of them?
I'm saying it's one of the reasons behind them. She could have had some of these symptoms before. If it's autoimmune in nature, she may have a subset of Sjögren's disease, which is a connective tissue disorder. So the idea is we need to look at not just normal blood tests, but we may have to look at some other things. Like we have to look at micronutrients. We may have to look at environmental exposures too. So there are so many things to look for. But I'm going to tell you, John, the biggest thing is there is fire in the body somewhere. Yes. Inflammation is the culprit.
Yes.
So where is this? Well, I almost feel like it doesn't matter. What we have to look at, of course, is her inflammation markers, which, by the way, she had a test, and the particular physician ultimately said, well, your SED rate's high, your C-reactive protein's high. I probably think you have more likely an autoimmune disease. Well, I don't really care. What I know is that she's suffering from all of this, and what I want to do is help her eliminate this and improve her quality of life. Can't cure.
And how do you do that?
Well, I'm going to do it with vitamins like B1. I'm going to do it with niacin. I'm going to do it with pyridoxine, B12, certain types of B12 that actually are essential for nerve function. I'm going to look at using some, and again, I'm going to look at using all of this through hydration, and I'm going to look at possibly looking at other things I would use in terms of the homeopathics and possibly the herbals, because I need to really make sure that we're not just looking at some of the other autoimmune disorders. So, again, I'm going to use a combination.
And do you think this will work?
And
how many treatments? Really, that's the more important question.
Well, she's thinking, in for the long haul.
I'm
you know, she
30.
knows it because, again, she could have something like a form of celiac, Hashimoto's. She may have lupus. She may have Sjögren's, variations of that I talk about all the time, subsets. Just because you don't have the major issue doesn't mean you don't have a subset of that is contributing to this POTS syndrome.
You know, it's interesting. How many times have you had patients come to you and they said, you know, my doctor said it was anxiety.
Oh,
my doctor
goodness.
said it was this, and they didn't really think they could treat me.
Well, you know.
So here we go again.
Well, you know, I had a very wonderful physician professor who worked with me in the very beginning of this clinical endeavor. And he said, Dr. Molly, I want to always tell you to remember that even crazy people can be sick with autoimmune or other disorders. And I've never forgotten that. Never forgotten that in 26 years, because I've seen my share of people who come in who were told it's in your head.
Yes.
And it ultimately is, but in physiologically.
And I can think of a few patients who've told me that.
Yes.
And they're visiting your clinic.
Absolutely.
So continuing with this P.O.T.S
right.
case, what do you think the prognosis is
in
the long haul?
Here's the thing. I think we're looking at long haul COVID also. And we're seeing that, if they had POTS prior to the COVID, then their existing symptoms have exacerbated. So we really have to look at helping them through the long haul again with what we use for the most part in our long haulers hydration. In addition, then, also looking at helping them tone down certain of the autoimmune challenges. So we also have to look at this in terms of a genetic cause if it did happen prior to or post the COVID. That's important as well. So we have to look at this and say, okay, what can we do? Because if they're activating our white cells and what it's doing like an allergic reaction, I may have to use some other things. So this is going to be an interesting case.
Yes, it is. And you figure at least 30 treatments,
I
right?
do.
Yeah.
I do, at least. And initially, I really want her to come in 3 times a week. And she has said she can do that because she just can't live with this anymore. Yeah. And I got to tell you, the dysfunction is really... I'm encouraging her to look at support groups who are out there for POTS, and I want her to realize that this is the kind of thing that we really have to look at together, both conventionally as well as functionally, like we do in our clinic.
Well, we are at the halfway point of our show. Time flies when you're having fun, right? It's Health Watch, Sundays, 8 till 9, Talk Radio 1210, WPHT. I'm your host, John DeMasi. If you have a question or a thought for Dr. Molly, 855-839-1210. 855-839-1210 is our number here in the studio. Again, the show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. With Dr. Molly Fantasia, I'm your host, John DeMasi. We will come back with more of today's edition of Health Watch after these words. We are back here on Health Watch. And again, operators standing by at Innovative Medical Associates, 856-489-0505, 856-489-0505. You can call now, or you can call after 9, or you can call later on this afternoon. They'll even be working during the Eagles game. That's how dedicated they are. 856-489-0505 is the number. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. A lot of good information on that. Check it out if you will. Innovativemedicalassociates.com is the website. And again, our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. The number here in the studio, 855-839-1210, 855-839-1210. Kind of continuing on this vein, Dr.
Sure.
Molly, a long hauler is really what this is as far as COVID.
Right. I was talking about that in reference to the POTS, but also I just recently came across a PubMed article about the cardiovascular complications of COVID-19. And this article went on to say that people who contract, somewhere between 1% and 10% of individuals who contacted SARS-CoV-2 can develop these complications such as myocarditis, pericarditis, and even blood clots building in the arteries. Now, these cases are difficult for physicians, and certainly they're difficult for us as well, because we're talking about very small blood clots in very small peripheral arteries. And interestingly enough, they cited a case where someone's fingertips turned blue out of just a week after contracting the disease. So, of course, that tells you what? They're having P.A.D, peripheral artery disease. And why is that? And they couldn't find on the Dopplers any blood clots, the large blood clots. But it could be these smaller blood clots and the peripheral blood arteries. And what would you think we could do in our facility to help a patient along these lines? Yes, they have to see the cardiologist. Yes, they have to take the medication. But I will tell you, it's inflammation personified. And what we can do is use what? Chelation therapy to help these people, along with all the other things we use in the post-COVID. That's what I wanted to get out.
As your former medical director called it, it's the liquid plumber.
Yes.
Okay?
Yes.
So it'll clear it up. Okay, that's important to know. 855-839-1210 is the number. Again, 855-839-1210. I want to say, and this is not normally the case, but you had a patient, and this was very sad because I was at the end of my drip on Thursday, and it took 3 people to get her into the chair in your facility, in the room where the hydration room.
Right.
And so you said, rather than move her, I'm going to come to her.
Right.
So I happened to be in the room, and I was the only one in the room.
Right.
So
but I also asked permission if we
yes.
could do that.
Yes.
And the family said, please do.
Yeah. And so you want to talk about this because this is really a sad case.
This is a fairly young woman. She's in her 60s. And she was entrepreneurial, retail stores, and very intelligent woman, and actually still is an intelligent woman, has a little difficult time speaking. But she has ALS, and we know what that is, right? It's affectionately known as Lou Gehrig's disease. Allegedly. They can't pinpoint it. They haven't given her a definitive diagnosis, but it looks like it could be an ALS problem, because she has trouble with spasms and she's having problems with her tongue, etc. Anyway, she was referred to me from another physician who said her quality of life needs to be improved. And unfortunately, what we can do is not going to be enough. So they came to me, and I looked it over, and I realized I had to do some more testing. Again, I need to look at some things like the vitamins and minerals that she's taking and see if we can improve some of the muscle functioning by utilizing some amino acids, some B vitamins, all through the hydration therapies, I might add. And in addition, it was an interesting thing because my nurse and I said, look at her tongue. And her tongue was coated with a white material that wasn't related to antacids or any of that. It really looked like thrush, which is like a fungus. And we've seen this before in people who have really bad autoimmune, debilitating kinds of conditions. So, I spoke to the medical director. The nurse gave him a nursing report, and we ordered something called Magic Mouthwash for her to help eliminate some of the pain she was having on the tongue. And that's what you were seeing, John, the tongue pain as well as the muscle pain. So she got them. By the way, I want to give you an update. I phoned her over the weekend, and she got the Magic mouthwash and is doing okay, doing better. And indeed, my protocol is really going to function on her functionality. We're going to really hone in. We want to help her improve if we can. I mean, this is a really rough case, John. And the problem is the traditional physician explained to the family that there's not much hope, that she's going to be relegated to the wheelchair, and she may well be, but I sure would like to get her being a little happier, and that's really our focus. So we're going to do this with hydration, and I'm going to keep the people people posted. But the family is pretty knowledgeable. They were seeking out help both homeopathically with certain injections for the muscles to help regain some muscle mass. But my thing is, I believe fundamentally she's going to do better with things like the MSCs, which are regenerative medicine, and utilizing the B vitamins and certain synergistic amino acids along with this. So this is going to be a long haul too, John.
Yeah, I must say I don't sit in on your consultations, but from just watching you and comparing it to that doctor who said, "Oh, there's no hope." Or,
No, I'm never going to.
You really have a good bedside manner, if you
Well,
will, and so I mean, talk about.
You know what? I don't want to think of it in bedside manner because I don't practice medicine, but what I do practice is kindness, and also, as I like to say, referred in one of my books, there's no remedy like the tincture of loving kindness for a patient. None. It is the most important thing. And I will also say that this patient called me after I spoke to her because she got my cell phone because I called on it, called me back, the daughters, and wanted me to know how important that was. My whole staff actually understands that one of the fundamental things we do in our facility is the compassion and the tincture of loving kindness that we give every patient. And it's really necessary because most people come to us, again, not like the spa. We're not here to just make you look pretty. Most people come here because they truly have some serious and challenging, even if it's not serious in our eyes, it's serious for them because it impedes some portion of their quality of life.
You help me look pretty, don't you?
Oh, yes. That's different. Now, I'm not saying we don't help you look pretty. Please don't hold that against me, guys. But I'm saying it's not our primary focus.
Yeah, but this was really a sad case, and
yeah.
and you're doing your best to alleviate the problem.
Right. And I want to, and since you brought that up, John, I want to end that particular segment by saying, listen, we can all take a page out of our lovely Linda, my tech, who says, listen, she tells patients, it's better to look good than feel good some days. But in the end, we're all focused on quality of life.
Okay. Do you want to talk about maybe some other patients
I sure
to help
do.
people?
I sure do.
To kind of understand what you do.
Well, it's tough. So this week, actually, last week we actually gave my post-COVID patient Tim a different way of delivering some of the nutraceuticals and the MSCs that we were using, which is part of the regenerative medicine thing. And we did this by inhalation, which means he actually was breathing these in. And I followed up with him with an IV later in the week of some additional nutraceuticals and additional MSCs. And he said he was doing great. He felt great. He had a little bit of a hard time, which is interesting, getting deeply into his lung, taking that very, very deep breath and holding it and letting it out through the puffer, which tells you that even when you think you've improved, and you have significantly, this lingering COVID is there. I have a sense that this COVID-19 is going to plague me for quite a while, meaning my patients.
Yes.
And, we see it because it's just everywhere. It really is everywhere. And I would tell you, even if you had a mild case of it, you may be suffering from some of these post-COVID challenges that just haven't developed fully yet.
It's been 3 years.
I know, and we're still talking about it. But it just
ridiculous.
Goes to show you how these symptoms have been dormant in people and then just raise their ugly heads later. So that was one of the patients I had this week. Of course, I have two patients, cancer patients, one who has a very severe breast cancer, who is being followed by an oncologist but no longer wants to do any conventional treatment. Well, she's doing great. In fact, my ex-COVID patient picked her up because he helps volunteer now, and he's such a great guy. He picked her up to bring her for her treatment, and she said, Dr. Molly, I need to see you. So I said, what's going on? Because I saw your PET scan, and it looked pretty good. Everything seems to be relatively stable. She said, no, I wanted to tell you that my oncologist told me I'm doing pretty well. And I said, well, that's music to my ears after this past few months. But again, she is what I would consider someone who knows she had to do 30 plus treatments and is doing that. She's a lifer. She comes in at least twice a week.
And will continue to do that.
Absolutely.
And that is the case with some of your patients.
Absolutely. And there are others who get well in 10 treatments, 20 treatments, and they're on their own and come back once every month or every other month. I have a young man who's coming in for peptides, and he's coming in just for overall health. He had some fatigue, and he comes in as needed, and that's fine with me, and I'm glad he's doing it safely rather than listen to all these guys at the gym. The other thing that's going on, of course, with the weight loss program, which is doing well, using a peptide, that's been very popular, as you know, conventionally as well as alternatively. And people are losing a significant amount of weight. One of the women who we started about 2 weeks ago has lost 8 pounds. Now, you may not think that's much, but honestly, she said what's happening is she's feeling that she's able to do this a little less cumbersomely than what she was doing when she used to follow some of these other diets.
Okay, we are coming up on our final break of the morning, which means you still have time to call in with a question or a medical challenge. You run by Dr. Molly. 855-839-1210 is the number. 855-839-1210. That's our number here in the studio. Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. This is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. We are coming back with more of today's Health Watch after these words. We are back here on Health Watch. Operators standing by right now, and they will be there well after we leave you at 9 o'clock this morning. 856-489-0505 is the number. 856-489-0505. You can call in and make the appointment for Dr. Molly for your initial consultation, and that's really where you can get a lot of information and a lot of information as to how it applies to you and your medical challenge. 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, if you missed any of today's show and you want to hear it again, or maybe you slept till 8:45, who knows? you can hear it at 4 o'clock this afternoon, 4 to 5 this afternoon. Health Watch replay here on Talk Radio 1210 WPHT. Health Watch is the show, Sundays 8 till 9, the live version here on Talk Radio 1210 WPHT. 855-839-1210 is the number. A lot of people, you deal a lot with lupus.
Yes. So my patient with lupus has been a patient of ours for at least 4 years, and she was doing really, really well. And this is interesting because she always had some malaise, general malaise. The condition is a rough condition, and it affects breathing, etc. But what was happening in the last few weeks, and by the way, she had contracted COVID-19, side note. And in the last few weeks, though, she said she was feeling more lightheaded than usual. And, of course, we ran blood pressure on her, and it was a little elevated. But then, all of a sudden, in the last week or so, she calls me and she said, Dr. Molly, my blood pressure's going up and down, up and down. So I said, listen, it was over the weekend. I said, you really got to get into the emergency room because of, you have some comorbidities that really need to be taken care of. So she gets in there, and of course, they run the battery of tests. She's there for 5 hours, and they said, well, it looks like you had a bout of hypertension. You just need to up your blood pressure meds. So I said, well, that was probably good advice in the moment. She does see a cardiologist because with lupus, there is a cardiac implications, and we encouraged her to see a cardiologist. In fact, we referred her to one. So bottom line is she came into our office on Monday, and we, of course, did a hydration IV that included something called arginine to help stabilize the blood pressure. And it's been working. She has an appointment with the cardiologist on the 10th. But I'm starting to think, again, that many of her other symptoms are probably related to the POTS, that it may be a post-COVID syndrome, even though it's over 1.5 years since she had COVID. This is the scary thing to me. So people who have these comorbidities, could it be that this POTS syndrome starts then 1.5 years afterwards, and we're not putting it together with a post-COVID syndrome? And it's something that physicians are starting to do, and I think it's really important to do that because it's real, John. It's real.
How serious is lupus?
Lupus is pretty serious. I mean, and she has had it for quite a while, but I will tell you this, up until this particular bout, she was able, and still is actually able, to work almost 4 days a week, and she really keeps herself well. She eats well. I mean, she follows a high antioxidant diet. She comes in for an IV 3 times a week, and she takes very, very good care of herself. She was exercising a lot, which I think exacerbated this problem that possibly has a P.O.T.S type syndrome to it. So she had to back off of that because we were concerned that it would flare up some of the other symptoms.
So what's the prognosis?
Oh, she's going to be fine, but she really has to follow up with her cardiologist. This is why I say we are conventional in nature. We want to send you to the specialist, and gosh knows I have a whole history of them. I got another email today, yes, from another patient who I referred them to a cardiologist at a great institution, and I particularly like this cardiologist. And they said, geez, we're so happy you did. By the way, the patient's 91, and he didn't jump into doing a procedure, which is what I was worried about, because the other cardiologist wanted to go into this guy's heart and do some kind of procedure. And, 91, we should take it easy, right? And this cardiologist was the one we referred him to, was a little more thoughtful in nature and said, let me review this case a little more. I think Dr. Molly and the primary care physicians there were right in sending you.
So what are you doing for this lupus patient? Is this another lifer or what?
She's a lifer, no question. In fact, she's coming to work for me, so she's a lifer. And, I think I have so many volunteers I can't. Listen, I am one lucky woman because I have a lot of professional people who come to us, and when they start to feel better, they really want to spread the word that this is a wonderful option for people to improve their quality of life. Without saying get off of your traditional meds, you want to do the best of both worlds. And that's what I love about our facility. We do the best of both worlds, but we're always cognizant of your particular goals and where you want to go with your quality of life.
They start out as patients and then they become staff.
Yeah,
right?
I know. Not staff, volunteers. But I will tell you, it's very rewarding to see them. And I have a lot of people who are able to go back to their traditional practice. My medical director has a practice now, and she was a patient. If you had seen her when she came in with the MS symptoms, man, and see her now, different woman entirely. Believe me. Believe me. And so that is a rewarding thing, not just for me, but for her as a medical professional, to say, as a physician, look at what this can do for you. And again, we didn't just do this with the hydration. We use subclinical dosing of a particular pharmaceutical that we have made in tincture just for us, that we believe makes the difference in many of these people's lives.
I'll put you on the spot for just a minute.
Okay.
I want you to think of the most rewarding case you've had. And boy, that's probably hard for you to think of.
I guess
because you've had so many.
Well, it was probably back when I had that young guy, the young man, who's now in graduate school and doing really well. In fact, I saw him this week, unfortunately, at his granddad's funeral. And I will tell you this. It was so great to see him and see how well he's doing. And I was going over to give him a big hug, and he was coming over to give me one. And he introduced me to his wonderful girlfriend, who was beautiful and bright. And I was just so happy to see him have a quality of life, because when he came to me, they were telling him to make arrangements. And, yeah, he made arrangements for a life, and that's what counts.
And that's the thing. And I know you're humble and you won't really take the credit, but
no,
you deserve all the credit, because this was a patient. And I remember you said, I don't want him out on the floor.
That's right.
I kept him in a room because I didn't want the other patients to see him. And that's how bad he looked.
Yeah.
I mean, he looked like
he was a skeleton.
Yeah, it really was terrible. And
but it was my entire staff that pulled that through, all the physicians, all the nurses, everybody. Barbara with her knowledge of nutraceuticals. It was the entire, meaning oral nutraceuticals, and what I put together. It was the entire staff that did this. So I can't take credit for it, but I will say that that was one of the most rewarding cases I've ever had. But I've had many since then, John.
Yes, and I guess you can tell us what people should expect in the consultation, and
Well, I want
to
to hear-
believe in this because it works.
Yeah, well,
I'm living proof of that.
I know that. I know that, John. And with God's help, look, I believe that God is the great physician. He is the one that helps us. I believe in the power of prayer. I believe that God has given us many ingredients to improve our quality of life. Many times we can't put a diagnosis on something, and other physicians have tried and can't. But I would say don't give up, have hope, and remember that God walks with all of us.
And I can say honestly that if it wasn't for you, I would not be here.
I don't know about that, John. Nah, the man upstairs had a lot to do with it. Everything just fell into place that day, among others. We had a couple of days. I don't want to have any more days like that with you.
Yes.
But the fact of the matter is, I believe in divine design, and God sometimes brings us places and helps us with people. Look, I've had the most wonderful medical directors in my lifetime in this business. I've had some that weren't so good, but the ones I have presently are great, and the ones that helped me found what we do were great. So all I can say is I thank God every day for everybody.
Well, the word is believe. Believe that it can happen. And
come in and talk to people.
You can help them as far as making it happen. Well, that's going to put the wraps on another edition of Health Watch. Don't forget, we are here every Sunday, 8 till 9, here on Talk Radio 1210, WPHT. And if you miss any of today's show, well, you can catch it this afternoon from 4
go
to 5.
Eagles, though.
Oh, go Eagles. That's right. I will say that at the end. Okay.
Good man.
For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Catherine, and Donna. And then, of course, we have delightful Dee, fabulous Fran, Joanne, and our nursing assistants, Karen, Kathy, and Sandra. Thanks to everyone for listening. Don't forget, we'll talk to you next Sunday, 8 till 9, Health Watch, here on Talk Radio 1210, WPHT. Go Eagles!
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.